Namaste. Myself, jv'n Shivi Saxena, Faculty of Physiotherapy and Diagnostics, Discipline of Medical Laboratory Technology. My topic is poliomyelitis. Useful for BSc MLT 4th SEM and BPT 4th SEM students. Poliovirus. What is polio? Polio are also referred to as poliomyelitis. May be a highly caused by air epidemic that attack the system nervosum. Children younger than 5 years old are more likely to contract the virus than the other group. Accordingly, according to the Planet Health Organization, World Health Organization, first in 200 polio infections will end in permanent paralysis. However, because of the worldwide polio eradication initiative in 1988, now certified polio free, Americas, Europe, Western Pacific, Southeast Asia. The polio vaccine was developed in 1953 and made available in 1957. Since then, cases of polio have dropped in us, but polio remains persistent in Afghanistan, Pakistan, and Nigeria. Eliminating polio will benefit the world in terms of health and economy. What causes polio? Polio is caused by the poliovirus. The virus enters the body through the mouth. It is spread through contact with the feces of an infected person or through exposure to phlegm or mucus. When an infected person coughs or sneezes, polio can also be transmitted by handling objects that are contaminated with fecal matter containing the virus and then putting your hands in your mouth. Poor hygiene or unsanitary conditions leading to contamination of food or water supplies with the virus have also been linked to polio outbreak. A person who is infected with the virus can remain contagious for 1 or 2 weeks after symptoms first appear. An infected person can carry the virus and infect others even if he or she does not appear to be sick. Although people if of any age can get polio, children aged 5 or younger are greater risk of infection. Symptoms. Although polio can cause paralysis and death, the majority of polio with are infected with the virus don't get sick and are not aware they have been infected. First, non-paralytic polio. Some people who develop some symptoms from the polio virus contract a protein of polio and that does not lead to paralysis. This usually causes the same mild flu like sign and symptoms typical of other viral illness. Second, sign and symptoms which can last up to 10 days include fever, sore throat, headache, vomiting, fatigue, back pain and stiffness, neck pain, pain or stiffness in the arms or legs, muscle weakness and tenderness. Paralytic polio. This most serious form of the disease is rare. Initial signs and symptoms of paralytic polio, such as fever and headache, often mimic those of non paralytic polio. Within a week, however, other signs and symptoms appear, including loss of reflex, several muscles aches or weakness, loose and floppy limbs. Third, post polio syndrome. Post polio syndrome is a cluster of disabling signs and symptoms that affect some people years after having polio. Common signs and symptoms include progressive muscles or joint weakness and pain, fatigue, muscle wasting, breathing or swallowing problem, sleep related breathing disorders such as sleep apnea. Diagnosis. The doctor will ask questions on the patient's symptoms and medical record, include whether he or she has recently traveled to area where cases of polio were reported. The doctor will perform a physical examination. Symptoms of polio may resemble those of other viral diseases. So, tests are going to be required to rule out other causes. If the doctor suspects you have got the virus, stool specimens and throat swab are going to be collected for testing. Two stool specimens and a couple of throat swab should be collected 24 hours apart. Specimens should be obtained as early as possible after the onset of disease, preferably within 14 days. Blood sample may additionally be collected for analysis. A spinal puncture could also be performed to gather spinal fluid to see for evidence of the polioviral infection. Treatment. Unfortunately, there is no cure for polio. Supportive measures could also be taken to ease a number of the symptoms and provide the body time to recover. Pain relievers like ibuprofen could also be given to scale back pain and fever. Fluid and bed rest are helpful, and those with mild flu-like symptoms, physiotherapy are often provided to stimulate the muscles and increase mobility. For those that become disabled, a mechanical ventilator could also be required for patient who have difficulty with difficulty with breathing. Prevention. The polio vaccine is safe and highly effective in protecting children from polio. About 99 out of 100 children who are fully vaccinated won't get polio. There are two forms of polio vaccine that are currently available. Only the inactivated vaccine IPV is employed with us. The opposite type, the oral vaccine OPV, is employed throughout other part of the world. The IPV is given as an injection within the arm or leg. Sometimes it's administered alongside other vaccines. Children should receive 4 doses of the polio vaccine consistent with the subsequent vaccination schedule. First dose 2 month age, second dose 4 months, third dose 6 to 18 month, booster dose 4 to 6 year. Thank you.